So this is a video on psoriasis. So what is psoriasis? It's a chronic condition in the skin where the the skin cells are multiplying at a really fast rate. So the what ends up happening is there's a pileup of excess skin cells. They all the strata become thicker because things are progressing too quickly. So the stratum granulosa is thicker because there's more cells in the granulosa layer, and that kind of thing. So it's this pileup, and it's a chronic recurrent sort of condition. It comes and it goes. So uh, it affects uh, it affects mostly white people. It's fairly rare in people of color. Um, 6 to 7 million people in the U.S. Lots of diagnosis. Most people have a moderate or mild case. Very few, 20%, say that it's severe. So there seems to be some sort of an inherited, because it runs in families. Now they don't know what's what what it is, but they know it's not infectious. So um, so there seems to be some sort of a trigger uh, that triggers inflammation, and then with that inflammation you get these cells in the stratum basale start proliferating very quickly. Um, so there's a genetically linked, but there's some sort of mechanical or an ultraviolet or a chemical injury. Sometimes it's infections. Could be side effects of medications, stress, smoking, endocrine things can all lead to it. When people have psoriasis, it comes and it goes. There's flare-ups and remissions, and times of stress or times of cold weather or anxiety all seem to aggravate it. So the most common one, and you've all seen it, is this plaque psoriasis. What you get is raised red uh, erythematosus plaques, and they get covered with a silvery scale. The outer layer, the stratum corneum, uh, is dead cells, and it's there. Um, it may or may not be itchy. If it is itchy, it's usually mildly itchy. You can find it just about anywhere. The trunk is very common. Knees and elbows are very common. Scalp can give pretty nasty cases of dandruff. Can be all over. It could be just in one small area. Sometimes it gets into the nail beds, and what you end up then is with your nails almost delaminating. They come apart, which is angiolysis, which literally means nail splitting. This is a typical psoriasis plaque. I'm sure that you've all seen it, or something that looks like it. This one looks like it's quite flared up. Sometimes people have it all over. again, this is fairly severe. Now, in our professions, it's difficult because it looks like it would be like you don't want to touch it, but it's quite fine to touch. It's non-contagious. It doesn't spread that way, and it is mildly itchy. Now, there can be other types, and we're not going to get into them, but the pustular has small pustules, but they're not infectious. The guttate is little small circular plaques, whatever. So one of the things that happens is that these plaques can get cracked, it's almost like chapping, and then that opens up the skin to infection. Not so much fluid loss; it would have to be pretty bad, and be leaking interstitial fluid to be involved with fluid loss. But nevertheless, infection is probably the more important thing, especially when it happens in places like elbows and knees where there's a lot of movement. You probably get more cracking. Plus, the scratching can introduce pathogens that way. A reasonably common symptom that goes along, or a secondary thing that goes along with psoriasis, is something called psoriatic arthritis. Psoriatic arthritis is a polyarthralgia. There's pain in multiple sites. Probably the most famous case of it is Phil Mickelson, the golfer. He has psoriatic arthritis. So the psoriatic arthritis, it actually resembles rheumatoid arthritis, and sometimes can be misdiagnosed because it may not appear at the same time that the skin lesions appear. It comes in a bunch of different forms. It can be a systemic sort of thing, and looking like rheumatoid. Looks like any sort of autoimmune sort of thing. It can be asymmetrical. Sometimes it's just in the distal interphalangeal, and so it'll look like osteoarthritis. There's a variant of it that really looks like ankylosing spondylitis, and we'll get to that later. But what happens is that the arthritis kind of starts in the SI joints and moves up the spine, so that you get this spondylitis sort of thing. So we don't know a lot about what's the actual cause, so that makes treatment difficult. It seems to be some sort of autoimmune, but who knows? So there's been all kinds of different things that help with the symptoms, but it doesn't introduce a cure. So a lot of topical things. Coal tar is one of the oldest ways of dealing with it, and it's literally tar that suppresses the proliferation of the cells. It's been around for a long time, and people still use it. Vitamin D and steroid creams, things like prednisone cream, seems to help. Uh, salicylic aspirin, salicylic acid. Um, Epsom salt baths, uh, I've heard of, and I know a number of people that have tried it, and really with very mixed success. Um, Sunlight helps, and so do like tanning beds and sun lamps. Uh, it There's an awful lot of people that find that when they can get sun on it, it seems to help, and it's probably got something to do with the vitamin D. Um, there are people that get so bad that they end up taking oral medications, steroids specifically, but there's nothing that cures it. So it may lead to remission, may keep this remission lasting longer, but it doesn't in fact cure it. Um, you should avoid lesions because the skin is compromised when you're massaging. It's just for the cracks and that kind of thing, but don't worry about it being contagious. It's not going to it's not going to infect your sheets. It's not going to infect your hands. It's the problem is in maybe introducing secondary infections. Now, times of stress seem to bring it up, so perhaps massage has a role to play in minimizing stress and stress management.